Hello everyone, my name is Dr. Ahmed Magoob. I am a pulmonary and critical care physician at Kingman Regional Medical Center. Today, I'm going to be talking about pulmonary hypertension. Pulmonary hypertension refers to increased blood pressure in the blood vessel connecting the heart to the lung. This blood vessel is called pulmonary artery. As a result, the heart will be negatively impacted by the need to work harder, and the lung will also suffer in the sense of compromised oxygenation. Pulmonary hypertension is divided into 5 groups in terms of its causes. Group 1, in which the disease is primarily originating in the pulmonary artery due to genetic or familial disorders, certain autoimmune diseases, certain other diseases such as HIV, or idiopathic, which means the reason is now well understood. Group 2, because of heart disease. Group 3, due to lung disease or sleep apnea. Group 4, resulting from chronic blood clots formation in the pulmonary artery or its smaller branches. And Group 5, which is multifactorial, in which more than one cause exists. The symptoms of pulmonary hypertension can be divided into early and late symptoms. Early symptoms will be difficulty breathing, especially on moving around, feeling easily fatigued or tired, particularly on doing activities, chest pain, and feeling dizzy at times. Late symptoms will be more and worsening shortness of breath, lightheadedness, dizziness, and sometimes fainting, swelling of your feet, ankles, and legs due to water retention, and symptoms pertinent to the disease-causing pulmonary hypertension, such as symptoms of heart disease and symptoms of lung disease. When you encounter any of the previously mentioned symptoms, please seek medical care right away in order to get it checked out. The workup for pulmonary hypertension entails comprehensive clinical and physical examination, echocardiogram, which is an ultrasound of your heart to check the pressure and the function of the right side of the heart, which is a site in connection with your pulmonary artery, imaging of your lung, such as a chest X-ray or CT scan to check the lung tissue out, blood work for a certain chemical material that's secreted from the heart in more levels when the heart is under more pressure or strain, workup in reference to the disease suspected to be causing pulmonary hypertension, such as breathing study if lung disease is suspected, sleep study if sleep apnea is suspected, blood work for autoimmune markers if autoimmune disease is suspected. Ultimately, you will need a procedure called right heart catheterization in order to definitively diagnose pulmonary hypertension. In this procedure, a catheter will be introduced to the right side of the heart and the pulmonary artery to measure the pressures in these areas, and that catheter can be introduced from a large central vein in your neck or your groin. Once workup is completed, your doctor will be able to determine 3 things: the cause of your pulmonary hypertension, the severity of your pulmonary hypertension, and the degree of your physical activity limitation. And this is important in order to guide therapy moving forward. The mainstay of therapy will focus on addressing the underlying cause. If it's heart disease causing it, then treat the heart. If it's lung disease causing it, then treat the lung, and so forth. Oftentimes you will need water pills, namely diuretics, to reduce the extra blood volume from overly stretching your heart, and also to decrease any water retention you might have. If pulmonary hypertension is caused by chronic blood clots, you will need blood thinners, oxygen supplementation to maintain your body's oxygenation at an optimal level. There are certain medications called pulmonary vasodilators, aiming to relax and dilate the pulmonary artery and hence decrease its pressure. Those medications are mainly used in Group 1 pulmonary hypertension, in which the disease is primarily originating in the pulmonary artery. These medications come in multiple formulations: oral pills, inhalation, subcutaneous infusions, and intravenous infusions. Your physician will be able to choose the right regimen for you based on the disease severity and the degree of your physical activity limitation. Finally, if the disease is very severe and progressive, despite of maximized therapies, referral for lung transplantation will be highly considered. It's important to note, if a female patient with pulmonary hypertension desires to get pregnant, please consult with your physician immediately, as pregnancy carries very dangerous risk for pulmonary hypertension patients. Thank you for sharing your time with me and watching our videos. For more information, please feel free to contact us or visit our website. Once again, this is Dr. Imad Maghoob. Have a wonderful day and stay healthy.